Hi, my name is Maureen Padilla. I'm the Chief Nurse Executive here at Harris Health System. I want to welcome you to Taub Hospital, our Level 1 Trauma Center here in Houston, Texas. We are very excited to have you join us this week and be able to share with you all of the great work and the patient outcomes that we're seeing here. Welcome, and we really look forward to learning from you this week.
It's a very exciting day for us to actually come to the point where we're being visited by ANCC for Magnet. The staff and management have worked for years and years to get to this point, and to have our application accepted was a really momentous event. But now that we're actually at the point of visits, it's really a very exciting time for us.
For a community-based hospital to have a Magnet recognition status, it will mean that despite all of the obstacles that we have to overcome, and that we still were able to push through and have the same standard as every other private hospital around.
Taub Hospital really serves a unique patient population in our community. We're here to serve all of those in our community that find themselves in a time of need. And that might be our patients who find themselves without insurance or perhaps underinsured. But it might also be you or your family members, perhaps in a time of trauma or a heart attack or a stroke. We're here to provide our entire community with excellence in care, no matter what your status is.
I love that I get to help people. I know when I go into work every day, I'm making a difference, whether it's big or small, especially with our patient population. They're very thankful and very appreciative of the time that we take to teach them and to educate them.
We are so excited to have this Magnet site visit, even at these challenging times, because our nurses, they are working tirelessly to provide this compassionate, quality care to our patients. And Magnet is all about nursing excellence, and we are more than ready to showcase our contributions to the society as nurses.
Harris Health and Taub particularly has a long history of innovating and adapting to the care needs or to perhaps limited resources. So the current situation with the COVID pandemic is a really great, timely example. Our staff have been extraordinarily resilient in adapting to the crisis. We have converted several of our units to be designated COVID-only units, and our nurses have performed really, really well. In fact, none of the areas that are dedicated COVID areas, none of the staff have actually converted or contracted the disease because of their attention to the patient care and their personal protection. The difficulty in caring for patients in situations like this, it's a scary time, but our staff, put that aside and care for our patients that need us more than ever during this very unusual time in history. The adaptation and resiliency is just something that can't be spoken enough of.
I feel privileged to be beside my patients at the time when they need me the most. Probably the best thing about nursing.
In nursing, I'm able to show empathy, compassion for my patients. And I like nursing because it's a place where you can actually bring somebody that has been feeling down to a level where they can feel happy.
Our nurses do above and beyond every day. They are actually doing so much more than their job. Having that conversation about the professional practice model made them realize that even a simple task, it matters a lot to our patients. For example, we've been asking questions like, what have you done in your last shift to help your patient? And one of the nurses said, my patient was in pain and she was feeling lonely, so I stayed with her and I took the time to talk to her about her hobbies and about her family and friends. So I took that 10 minutes to talk to her, and she actually thanked me for doing that. And it made a difference, and I'm glad to say that it made a difference in her life. So those are the kind of things our nurses do every day.
Being a nurse for me is like a vocation and a calling for me to help people that are in need.
I just get to help people, and at the end of the day, when they leave, when they get discharged with a smile on their face, it makes me really feel content.
Behind each and every care provider that is working in the front lines is an army of people here to support that work that's being done. And so really for us, this Magnet journey it's about the nursing staff, it's about the frontline care providers, but it's really about everybody else as well. We can't be successful unless every single person in this health system is committed to the same singular goal of providing the very best in care.
What I love about Taub is about the diversity, about all kinds of people that are working together with the same goals.
Very much proud to be in a hospital that has a magnet recognition because it shows that all nurses are very happy to work in the environment that provides all the necessary resources for them.
They are at the front line, they are the warriors, and we provide them the armor and everything else needed to do their job.
The work that we're doing has just been amazing. Our nursing teams have made such a big difference and impact on this community's health, and I think you're going to be able to see that demonstrated during your time with us. But they have worked very hard and have had all sorts of workshops and sessions as they've been preparing to really be able to showcase the work that they've done. So I believe that as you tour our halls on this virtual tour, you are going to be able to feel the excitement.